And it cannot be any diet. This is a specially formulated diet that decreases the chance of infection, improves your immune system, decreases the chance of you having blood clots, etc. Okay, so once you do your diet, you have a date for surgery, we're gonna go to surgery. Surgery is done with little holes. With the sleeve, most of the times I'm able to do the surgery with 3 little holes. This is how it looks like. After it's done, you're gonna have 2 scars. One is hidden in the belly button, so you will not be able to see that. And you usually see patients 1 week after surgery. And when we do laparoscopic surgery, we turn the lights off. There's a special camera inside. We put gas to create space, and we do the surgery looking at a monitor. I also do or perform robotic weight loss surgery. In this situation, this is the robot arms that are connected to the patient. I sit and control these arms with this special console. It gives me a better vision, more accuracy, especially helpful when we do revisional surgery or second time weight loss surgery operations. I also train other doctors on how to do this. The advantages of weight loss surgery with 3 little holes is that you're going to have small incisions, you're going to have less pain, you're going to walk the same day, you're going to go home the next day after surgery. Most people are able to drive after 4 or 5 days, depending on the type of work you do. If you're just sitting in an office, some people have surgery on Friday and by Monday they're back to work. Other people have to move around a little bit more, and sometimes it takes 1 to 2 weeks before you go back. If you are a person that works outside in the middle of the heat, that does a lot of physical work like oil rigs and things like that, we recommend usually between 2 to 3 weeks of time off. Most people are able to bike, run after 2-3 weeks, and after 4 or 5 weeks, we give patients the freedom to lift any kind of weights and go to the gym. We don't do lap bands anymore. I also do revisional surgery. If you've had problems with a first-time sleeve or bypass and you need a conversion to another procedure or a revision, we do that. We're going to have another video explaining that. In terms of surgery, the most common operations we perform are the sleeve gastrectomy and the Robotic gastric bypass. There's not one operation that is better than the other. They're different, and you and I are going to decide which one is best for you. As just general information, you need to know that when we do a sleeve, we cut the stomach and about 80% of the stomach is removed. We only operate in the stomach. And this operation, the sleeve gastrectomy here on the left side, is not reversible because once we remove the stomach, this is gone. In the case of the gastric bypass, we carve a small stomach out of the big one, but nothing is removed. After this new stomach is created, I count about 100 centimeters in the small bowel, and I cut the bowel that was here, and this part is going to be moved up, and I'm going to create a connection between the bowel and the new stomach so that when you eat, the food's going to go down your mouth, your esophagus, this small stomach, which is going to cause restriction, and then it's going to go straight into the bowel. A lot of people ask me, well, what happens with the stomach? Why don't you just remove it? Because that would take an extra hour of work, and because there's no need for that, we still need your stomach to make acid. The acid is going to go into your intestine, it's going to go down this route, and eventually there's a second connection here, and here's where this gastric acid juice, the pancreatic juices, the bile, come this way and get mixed with the food, and the digestion process starts. It's called the bypass because the food goes through this route and bypasses the stomach. Okay? In the case of the gastric bypass, it's a reversible operation, but we're operating on both your stomach and your bowel, and this is reversible. Okay? The gastric sleeve or sleeve gastrectomy, it takes about 30 minutes to do. In the case of the gastric bypass, our average operative time is an hour and 5 minutes. Okay, so what is the same and what is different? With both operations, after surgery, they're both done with little holes under general anesthesia. On both cases, you stay 1 night in the hospital. In both, the recovery is about the same. one thing that I'm going to disclose right now is that most people that have this type of weight loss surgery operations have a hard time eating red meat, a piece of chicken breast that is too dry, bread, and we're living here in the area of the Rio Grande Valley, tortillas. When you eat those things, it feels like it gets stuck here in your stomach, and people feel pain, discomfort. Sometimes you even get nauseous and you throw up. So weight loss surgery is not magic. It's not just doing surgery and you're going to eat anything you want and you'll be fine. No, you're going to have to make some changes in your diet. If you're not willing to give up the things I mentioned, like beef, red meat, okay, breads, and tortillas, this is not for you. Okay, this is not for you, because every time you do that, you're gonna have pain, you're gonna feel sick, you're gonna end up throwing up, and you may end up getting dehydrated and in the emergency room. We don't want that. So you have to be willing to make those sacrifices. What else happens after these operations? These operations are going to restrict the amount of food you can eat. Your food portions are going to be very small. You're going to have to eat slowly, chew well. We also recommend separating liquids from solids at least 15 to 20 minutes. In both cases, you're going to have to take vitamins every day for the rest of your life. And the best results are seen in patients who follow up. After surgery, you're supposed to come see us after 3 months, after 6 months, 12 months after surgery, and at least one every year. And every time you come, we have to check blood work and make sure all your vitamin levels are okay. Okay, so what kind of vitamins do you have to take? Okay, so the regular over-the-counter vitamins, gummy vitamins, are not enough. You have to take bariatric vitamins, okay? And it's very simple. There's chewable, there's capsule, pills, liquids. We will teach you more when you come to see us and when you talk to the dietitian. All right, so what is the difference then? When do we choose one surgery over the other? Okay, so the sleeve hysterectomy, with the sleeve hysterectomy, you lose about 60% of the excess weight you're carrying. With the gastric bypass, you lose a little bit more, about 60 to 70% of the excess weight you carry. So there's a little bit more weight loss with the bypass. What else? With the gastric sleeve, there is a small chance, which is 5%, of developing heartburn or reflux disease, and the need for you to take medications to control reflux. With the gastric bypass, you don't get reflux. And if you already have reflux before the surgery, the reflux will go away. So if you have a problem with weight and you suffer from a lot of heartburn and you want that to go away, the best operation for you would be the gastric bypass. Okay? Now, on the other hand, if you have diabetes, high blood pressure, and high cholesterol, both of these operations help you improve those conditions, and sometimes those conditions even go away, okay? But the bypass is a little bit more powerful than the gastric sleeve for that. What do I mean with that? If I have 100 patients who are diabetic and we do a bypass or we do a sleeve, about 60-70% of the patients who had the bypass will get rid of all medications. And about, I would say, 50% of patients who had the sleeve will get rid of all medications. The other thing you want to know is what happens after 5 years. So after 5 years, about 60% of patients who had the bypass are still off all medications, and about 40% of patients with the sleeve are still off all diabetes medications. So that's what I say, that both help you tremendously, okay? But the bypass is a little bit more powerful to treat or get rid of diabetes. The same thing goes for high blood pressure and high cholesterol. When you lose weight with both operations, you're going to improve your sleep apnea. The joint pain, back pain is going to improve. Whatever damage is already done to the joints cannot go away, but you know, those will improve. Okay, so with both you take daily vitamins. I mentioned the bread, the beef. We need to check blood work, okay? What are the most common complications? What are the most common side effects with these operations? So after surgery, when you have a sleeve or a bypass, the reason why you lose weight, it's not just because this stomach is smaller and here is a smaller stomach, but when we remove this part of the stomach is responsible for telling your brain that you're full, that you're hungry. And when this is removed, the hormones that carry that information to your brain, those hormone levels change. So your brain is now confused, and your brain thinks that you're full and you are not as hungry. Same thing happens with the bypass, among other things. I'm just making a simplification of what goes on with these two operations. But these operations cut your appetite, and that's how people lose weight. They also have mechanical restriction because they don't allow you to eat much. But the main effect is decreasing appetite, hunger. The other thing is that your metabolism is going to go up. It's going to be higher. What does that mean? It's like when you go into a house and you have the thermostat set up at, I don't know, 65 degrees. If you want that house colder and you turn it down to 60, you're going to consume more energy. Your bill is going to be higher. Same thing here. You're going to consume more energy after you have this operation, so it's easier for you to lose weight and keep it off. Okay, that is one of the mechanisms. So, but at the beginning, right after surgery, you're not going to be able to eat. The only thing you're going to be able is to drink liquids, and at the beginning it's going to be sips at a time. Okay, so the first 2 weeks after surgery, you're just going to be on liquids. After 2 weeks of being on liquids, we're going to advance your diet to pureed. It's like baby food. Everything has to be blended, mashed. And after 2 weeks of liquids and after 2 weeks of soft pureed diet, that's when we're going to start soft solids. So in the first 2 weeks, because you're just on liquids, you're going to be weak because there's no gas in the tank. So it's going to be hard for you to go up and around and run and do things like that. Weakness is the most common complaint. Occasionally, patients may feel dry because you're not able to put enough water in your system. And when you get dehydrated, you may also become nauseous. But that's very easy to treat. If you get that, you come to see us. We give you an IV, start IV fluids, and it's like a dry flower. We give it water, and it looks beautiful. Same with you. You look sick, you feel nauseous, you don't feel well. We give you IV fluids, and boom, fixed. Okay, and that's not common, but it's possible. We don't want you to get so dehydrated that we're going to end up sending you to the hospital because that would be very expensive. Okay, what else happens after surgery? The most common long-term problem with surgery is vitamin deficiency. We told you that after you have any of these operations, you're supposed to take vitamins. Well, some people lose weight, they feel great, and they're like, well, I don't want to take the vitamins. And nothing is going to happen for the first 6-9 months. You only get into vitamin deficiency if you stop taking these vitamins for 9-12 months. Okay, now the other thing that happens, especially with the gastric bypass, you can get dumping syndrome. What is dumping syndrome? So here, because of this connection of the little stomach straight to the bowel, if you eat anything that has sugar, and I'm just not talking plain sugar, but it can be ice cream, juice, even ketchup has sugar, a cake. If you eat that, instead of your sugar level going up, it's going to go down, and you're going to feel weak. Like you have to sit down. Like sometimes people even say that they feel they're going to pass out. Besides that, the hands get shaky, and the heart goes fast. It's a very uncomfortable sensation. On some patients, they may even feel a little bit of a crampy pain. They can get nauseous or even make an episode of diarrhea. So the bypass can cause dumping, and you need to stay away from sugar. If you don't, you're gonna get in trouble, because if you keep eating sugar and sugar, you're gonna feel sick, nauseous. You may end up getting dehydrated. You don't get any dumping with the sleeve, or if you get it, it's mild, and most of the times it goes away after 3-4 months. That's why the sleeve has become more popular, because if a patient, cheats one day and eats something that's super sugary, not much is gonna happen. But if you do that with the bypass, you're gonna feel sick. Okay, all right. Now, another one is, what is the chance that I lose the weight and I gain the weight back? Or what is the chance that I don't lose the amount of weight I want? Okay, well, that's possible, because I'm not going to come here and tell you that everybody loses weight and everybody keeps the weight off. No, the success rate of weight loss surgery after a long period of time, which is between 5 and 10 years, is about 80 to 85%. So there's a 15 to 20% chance of either not losing enough weight or gaining all the weight back after a couple years. Okay, now listen to this. I always tell my patients that there's three factors. One is your genes. Nobody can change your genes. Some people are born with genes that make them heavier, and some people are skinny no matter what they eat, and that we can change. The number two is your metabolism, and I already explained that I can accelerate your metabolism and make you burn more energy. The one thing I also cannot change are your habits. That's on you. You can have a sleeve or a bypass, and they will both restrict the amount of real food you can eat. Beans, rice, vegetables, meat, and things like that, okay? But those surgeries will not stop you from drinking sugar. In this case, you can drink soda, juice, ice cream, milkshakes, margaritas, beer, and those are just calories that are going to go through. And if you keep doing that, you're not going to lose as much weight, or after a couple of years, you'll gain all the way back. So, like I said before, this is not magic. There are some changes that you have to be willing to make. Same thing happens with the bypass. Some people start eating junk food, papitas, chips, nachos, Doritos, Takis. So many, I can name them all, okay? Now, just for clarification, I mentioned before that it's hard to eat meats. That's usually with red meats. Most people have, or nobody has problems with fish because, you know, fish is very soft. Chicken, if it's a moist piece of chicken, it's also going to be okay. Okay, now if after a year and a half, most people can eat a small piece of meat, but you have to really chew it and take your time. All right, we're almost done here. The last thing I'm going to mention is that there is a chance of major complications with any surgery. Gallbladder removal, appendix, hysterectomy, C-sections, and weight loss surgery is surgery. So there's a chance of complications. What are the major complications that can happen with these operations? The serious complications include leaks, bleeding, and blood clots. Let's start with blood clots. What does that mean? When you're in the hospital after surgery, or because you have a medical condition, you're going to be in bed and you don't move. If you don't move, the blood is going to pool in your veins, and some people are genetically predisposed to develop blood clots. If you develop a blood clot in your leg, it's going to get red, painful, and swollen. That can be treated. The problem is that sometimes a blood clot can break and go to your lungs. That is called the pulmonary embolism, and that's very, very dangerous because it can take your life. So we are very, very serious about it, and the number one thing to prevent that is to get you up and around. That's why that diet that I talked about before is so important, because if you diet and the surgery goes fast, you use less anesthesia. After you have your surgery, you go to your room and you're going to be on your feet and you're going to be walking right away, and you're not going to get any blood clots. Okay? So that's rare. I've only had 3 patients that have had blood clots ever. Okay? And I've never had a patient that had a blood clot that went to their lungs. Okay? What else do? We give you blood thinners before the surgery to thin your blood and prevent the blood clots. Okay? So the other complication is bleeding. So if I give you blood thinners, there's a small risk of bleeding compared to somebody who doesn't take a blood thinner. Okay, but if you have bleeding, I can stop the blood thinner. I can give you blood. In the worst case scenario, I'll go and put a stitch or a clip and control whatever is bleeding. But if you have a blood clot and it goes to your lungs, there's very little I can do to fix that. Okay, all right. So leaks. What is a leak? A leak means that you get a perforation. Let's say I did a sleeve or a bypass, and you see here we cut and seal at the same time. There are connections here, right? Let's say I told you in the first 2 weeks it's just liquids, and you go and for some reason decide to have a Whataburger that has bread and meat. The 2 things that I told you are going to get stuck. So if you eat that, it's going to get stuck here or here, and immediately you're going to have pain, you get nauseous, you're going to start vomiting and retching, and you only had the surgery 2-3 weeks ago, and from all that force, this can pop open. That is a bad complication, okay? So as long as you do what we tell you, you're gonna be fine. And that's only happened to me once ever with a sleeve. It's a rare event. Statistically, it happens in 1 in 300 patients. We've done more than 1,000 sleeves and a total of almost 2,000 cases. So our complication rate is very, very low. Okay, just to finish, I mentioned this already, the clear liquid diet for 2 weeks, the pureed diet for 2 more weeks, soft diet. You have to eat small portions, chew well, take your time. Bread and red meat is going to be a problem, okay? So in summary, the message here is that weight loss surgery is not a magic cure. It's a tool, okay? You can't expect to lose weight if you have surgery and you ate everything you want. No, there's some changes you're gonna have to make. Okay, you have to make eating habit changes and lifestyle changes. Exercise helps because it will make you healthier, stronger, and you will be able to lose more weight, and it prevents you from gaining the weight back. Okay, I did not mention anything about cash paying and cash options in this seminar. I'm gonna explain that in another option, but just briefly I'm gonna say that if you don't have insurance, or if your insurance does not cover weight loss surgery, or if you have insurance, it covers surgery, but you don't meet the criteria for surgery, we offer cash options in the US and also in Mexico. Thank you very much for your attention, for attending this long seminar. We're gonna have we have other videos and seminars that target specific problem, like combination prices, like insurance verification, like life after weight loss surgery, etc. So we're gonna put them up on YouTube, or you can have them up on request. You just need to send us a message on our Facebook page, which is Mario del Pino MD. Send us your email and we'll send you a link so you can check our videos. Thank you very much for attending and have a great day.